Record. Welcome to the first September sales call, Concierge Orthopedics. We've got Dr. Shania Grody here talking about upselling and downselling today. So we're excited to learn.
Awesome.
Well, I'll hand it over to you.
Thank you. So thanks for joining today. We're going to be going over how we can be more profitable as clinicians with upselling and downselling. So how to navigate that, what that looks like from a first encounter, second encounter, and discharge perspective. But first, we're really just going to delve into what upselling and downselling is from a I guess what we want to say is like a consumer standpoint, because we're always being upsold and downsold. So I'm going to go over a few examples here of upselling and downselling first, and then we'll delve into how we can apply that to our practices. So big things with upselling. And I also want to give a shout out to Alex Hermosi, because a lot of this content too has been very beneficial from some of his podcasts and his content that he has. But specifically, a couple examples that he had given, like, is do you want fries with that?
Hey,
Where's that
Mary.
from?
Hello.
So where's that from? Do you want fries with that?
McDonald's.
Yep. Do you want to make it a meal? Anyone know that one?
Is that it?
Also,
Burger King?
McDonald's or any fast
Chick-fil-A?
food. They're always
Okay, I
like,
was gonna say Chick-fil-A.
yeah,
Who are you
yeah.
saying, Mary? Burger King?
Mm-hmm.
Yep, that's exactly right. And then I think a big one that we've run into lately as a family is Costco. Do you want that turkey provolone sandwich with anything that you get from the concessions? So these are all upselling examples. And then I know I was really going on the food because I feel like it's really relatable, but like Apple, right? You go buy a new iPhone, they're like, do you want the 62 gig, or do you want the 100 gig, or do you want, like, that's all upselling. It comes at a premium price point. And also the high def or high res. Same with like MacBook Pro versus Air. You guys understand that?
Sometimes I feel like I don't understand technology
I know.
anymore.
I'm like,
Okay.
I know it's upsell, downsell. Now I could not tell
Yeah.
you the difference
So,
between those.
so
I'm with you.
big thing with the MacBook Pro, it has a lot more storage and it has like Retina display options. So that comes at a higher premium. They're not gonna
Okay.
they're not gonna tell you, hey, this one's $2,000, this one's $1,000. They're gonna say, hey, do you want the Retina display and do you want to ensure you're not running out of storage? And you're like, yeah. So you're gonna pick that
What I'm
Pro.
gonna get, not the price. What it's
Exactly.
gonna do for me, not the price difference. Yeah.
Exactly. So that's why I wanted to give you guys some real world examples so we can understand this from our consumer standpoint. Okay, and then downselling. So if you're that consumer that's like, no, I want that, lower price point. Let's just stick with the iPad or iPhone. We're gonna go with the lower storage and maybe not as premium of display. Does that make sense?
Mm-hmm.
Okay, cool. And then how about TVs? What do we know about TVs? Because we all have TV.
We do. I have
What do
a
they
frame
do to
one
upsell
now,
us?
and it's so fun. They put pictures in a
Yeah.
frame that you can buy, and hey, guess what? There's a few that are free, but you got to buy the subscription. And if you
Mm-hmm.
do 1 month, it's the price, but then if you do a year, it's a lot cheap. It's
Yep.
all.
And I think like
Yep.
resolution and size. So if you're
Hmm.
gonna
Yeah.
buy a 90-inch TV versus a 60, that's an upsell versus a downsell. So going with the 60 instead of the 90 is going to be a downsell for you, even if you don't really think it is. It is. And then I think like a really good food example, just because I want to tie this back, is like a take and bake pizza versus something you ordered to your home, right? If you have to put a little work into it, right? And it's not just delivered to your door, hot, ready to go, it's going to be a lower price point. But we don't always think about it that way. We think of like, oh, take and bake, convenience, whatever, versus like Domino's delivery. Does that make sense?
Mm-hmm.
Hmm.
Okay. Now, I want to clarify, do we all understand how these are upsell and downsell examples?
Yes.
Okay. Do you feel like you fall into the traps of the upselling?
Oh, you can sell me all day. You want VIP? Yes, I do. I would like that.
Do you want that? Do you want that soda, Kelly? You want that soda for 50 cents?
Of course
Right?
I
And
do. Well,
yeah.
and it's cheaper than buying the soda by itself,
Yes, and
So,
that's the big thing too, is like package price point. So
Value.
right.
now that we've gotten like a little bit of a taste of how we as consumers do this, we're going to take this and apply it to how we as providers can utilize this with our patients. So don't worry, we're not just going to talk about food and computers all day. So big things is this is going to be patient examples. So we're going to go into first encounter, second encounter, and then the discharge. So I want you guys to think about, and I have my examples obviously because I'm presenting today, but first encounter, what is the first encounter? It's initial evaluation, right? So how are we going to upsell and how are we going to downsell? Do we have any brainstorming things we want to delve into with regard to that?
Well, would the package, selling them a package be an upsell?
Yep.
Sorry, Mary, you go right ahead.
Go ahead, Mary.
That's okay. I was gonna say either like accommodations, like meeting them at their gym, or it's like, hey, let's get together at your gym. We'll work on things there. Or
so why is that an upsell?
Because you would be well, I want to find another word besides accommodating.
Yeah.
But it's you're making me as a customer feel a little bit more attended to. It's like,
yep. So I think
my
the
time.
barrier to entry is gone. And I don't mean to cut you off, but like you just got rid of the barrier to entry, right? Because now I'm coming to you. You don't have to drive to me. I'm like, yeah I'm in, right? Is that what you're thinking, Mary?
Yeah. That's, I mean, one of the things that it's more convenient for me.
Yes.
There's less hassle, less other stuff for me to worry about.
100%.
Because I'm being accommodated to. So you're meeting me where I want that I'm going to be at anyways. So.
Yes, good. And I did not mean to cut you off. I just think you're killing the barrier to entry because like someone doesn't want to see you because they don't want to drive. Just like they don't want to go to the clinic. You come to them, they're like, okay, I'm in. Okay, that's great, the barrier to entry. But from a monetary standpoint, how is that an upsell?
You could charge more.
Exactly. Yeah. You're going to charge for your travel time. And that travel time is going to bring you more revenue than you would if you had them come to you. And you're probably going to be still doing a similar amount of work, obviously like mileage and gas, etc. But you're going to charge for that minute. So that's exactly right. So now we're bringing down the barrier to entry and we're also charging a higher premium. So that is an excellent example, Mary. Killed it, gold star, good job. So I'm going to tie both of these into what my examples were. So I think the big thing is we get them in for the eval, right? And Kelly, you nailed it. We want to sell them on that package. That is the bread and butter of how we make more money. And we've all seen that if you're selling packages currently, your paycheck is going up substantially. And that's because packages are not only going to increase that initial buy-in, but they're going to elicit higher results and a higher return on investment for the patient because you're going to book those visits out. You don't have to worry if they're like, nah, I don't know next time. Like you already have the money. So it's like a gym membership. If you paid, you're probably going to use it more than if you haven't paid yet, right? So the big thing with these is we need to sell these in a way that is going to get them to buy in. So Kelly does an excellent job at this with, trajectory of sessions. So are they going to need 4? Are they going to need 6? Or are they going to need 8? And why am I utilizing these numbers?
Because those are well, that's the common amount of time. Is it going to be 1 month? Is it going to be 2 months? Or is it going to be somewhere in between? Is the way my treatment brain would think.
100%. So with that said, okay, so we're like, hey, I think you need 4 visits. Awesome. If you prepay, you save 9%. Okay. We just made $559 off a $175 eval. Boom. That is how you upsell, but it's not as easy as that because they might say, I don't know. I don't really know about it. So you could show them, you could say, you know what? You're going to save $41 by doing this. And they're still like, I don't know. And you're like, okay, what specifically don't you know? And they're like, I don't know if I'm going to need that many visits. Like, how do you even know I'm going to need 4? And you could follow with, well, based on my previous experience with your type of injury, we'll just use knee rehab for an example. This is what I've seen, and usually it takes about 4 visits to get you there. They're still like, I don't know. Like, what if it doesn't? Then you upsell them again, and you say, you know what? If I get you better in 3, I'll utilize that 4th, and what we'll do is we'll work on preventative measures for the future for a different injury. I'll just prorate it, or I'll advance your home program after it comes back in. I don't know. Okay, there we
It
go.
just disappeared. And I heard, or I'll advance your home program.
Yep. So, or I'll apply it to advanced home program. So after they discharge, if they want to come back to you, you use it for that session. So there's options because this can't be a one-way street. So we need to figure out those options. Does that make sense?
Yeah, I know. That's probably one word that I use so many times when I see people for a session, especially currently, where it's like, well, you just tell me what to do. It's like, that's I'm like, that's not what I do. I'm like, I give you options of what we're going to do. I'm like, these are all good options. Doesn't matter which one. I'm like, I want you to decide what you want to do with it.
I love it.
What do you want to do with your time?
I love it. And I think we can't be uncertain. We can provide options, but we need to be firm in what we're providing. So if I say 4, I'm just going to do this in red. If I say 4 and I'm like, you might need 8. They just lost all confidence in me as a provider. So it needs to be firm. 4. You choose 4, you better be darn sure it's 4. And if it's more than that, then you have a conversation at a later time, but be confident in your delivery. Otherwise, you're going to lose the sale. Confidence sells, no matter what it is. Okay, downselling, free. What do you think when you see free? Anyone excited about that?
It would certainly be dependent on, like the store or what's free, the item, because there's
free
plenty
stuff.
of things you don't want. But.
Yeah, if I see free, I'm like,
sometimes you might think kind of where you're hitting to, I think, Mary, is like, oh, that might not be a very good service or value if they're willing to give it away for free.
Good point. Good point. But with this, if you're getting something for free, you don't have to pay. So very low barrier to entry. So back to that barrier to entry point, like hi, Mike. I have no investment. You're good. You're good. I have no investment whatsoever. So I'm like, okay, like I'm more apt to try this now. I don't have to pay $175. But in our case, this comes with value. So free consult call. Okay, now what do you think? So you guys were a little skeptical about the free. So what do you think now that I'm like, it's a free consult call? Are we a little more bought in?
Yeah.
Okay. Because normally you'd have to pay for something like this. So if they don't even want to do an eval, when you talk to them initially, whether that's this is more of an in-person type of thing, because if you're talking to them on the phone, you're probably already doing the free consult call, you can start selling them on the spot. I think the biggest place where we fall short is the questions, right? So, okay. So we do the consult call. We determine they need an eval, okay? And they're not still bought in yet. They're like, I don't know, I have a copay of this amount. I'm not sure, yada, yada. But we're going to use a shoulder for an example. Their shoulder injury has been going on for years. And you know what? Their pain is only going to get worse. So we're going to talk to them more about what they're not able to do and how we can help them. Jeez. I don't know why I keep doing that. Anyway, so if I said to you, Kelly, why would I not want to do therapy with a $20 copay? Like that doesn't seem like a lot of money, right? So if I'm saying that to you and you're doing a consult call with me and you're trying to sell me, what would be a specific question you would ask me about my shoulder injury for that instance?
You're saying if they just want to go to traditional PT with a $20 one and they don't want to come to me.
And they don't even want to pay that. But now you got to sell them on a $175 eval. So what are you going to ask me as a clinician, because I'm the patient with the shoulder injury, to get me bought in?
Okay, so I have 2 questions in my head right now. One is what I would ask and one is what I think you might coach me to ask.
Okay.
So I would go to function first. I would say like, hey, what is this keeping you from? Like, what is there anything you can't do that you need to do?
Okay.
Is where I would start. I'm
Yep.
wondering if you would say, and you can tell me if I'm wrong, why don't you want to pay even $20 for your visit? Is that what you would do first?
I think we need to do both. So I think I'd get into what's keeping you from, because we need the emotional tie to that. And I'm gonna say, I
Mm-hmm.
can't lift my grandbaby, and I haven't been
Mm.
able to since she was born. And I'm really good at spelling today. Um, since born. Okay, so that's the emotional piece. Okay, but now, yeah, like why don't you want to pay $20? So I'd be like, well, why do you say that? Well, so you asked me. We'll just do this for sake of time. You asked me why I didn't want to pay. Well, I had physical therapy after my knee surgery, and it wasn't that helpful. Boom.
Mm.
You just got an objection where you can sell and you can downsell them. Well, why wasn't it helpful? Well, I went in twice a week and it was like 20 minutes with the PT and I feel like I didn't even get better. And it was a lot of time. Okay. So we've got time, we've got, non-optimal results, and they're not bought in. So we need to play on that emotional piece of not being able to lift the grandbaby and essentially go into how we can downsell them from this eval. So I would say something along the lines of, this shoulder's been bothering you for a long time. I can assure you that when you walk out from your first visit, you're going to be in less pain than when you walked in. Does that sound like something you'd be interested in? And they're like, yep. And you know what else? Since time is of the essence for you, I think we should space these visits out. So let's book that eval. And then instead of you coming in multiple times a week, let's do once every 2 weeks so that I can give you the tools in that initial session. So you'll have plenty of stuff to work on in those first 2 weeks of therapy. So I can book you the next time and you feel comfortable and confident in, what you're doing. Does that sound good to you? And they're going to be like, yep.
Yes.
Yeah. Because before, they're going to have gone 8 times in that duration and they're going once, they're going to be bought in. So for us, it looks like, oh, well, that's a bad business model. No, it's a really good thing because you know what? You're going to probably sell them more in that eval and they might want to come more frequently. Does that make sense?
Well, and something's better than nothing, right? If the other option is not coming in and not getting better at all. And
Yep.
then you're also like destroying, in a good way, I should say, you're removing these ideas about physical therapy that they have that our counterparts have not been great at establishing so far. Just the mill, the PT mill, and that's what people think of when they think of PT a lot of times, which is unfortunate.
100%. And I think another thing we need to shed light on too is, you know what? I know that $20 copay, was something you weren't really interested in paying because the value wasn't there, but I can assure you that you're going to be in less pain and you're going to have the tools that you need to get better on your own, because our philosophy here is to not have you on our caseload forever, So just like really shining light on the objective. Decide that you don't want to, pay for a package today and save that 9%, we can revisit that on the next visit. Does that make sense? So like,
if you keep it as an option, it's like packages are always an option.
Yep. Because you know what?
So if you change your mind.
Yep. And I want to sell that package on the eval. But in this type of person, probably not going to happen. So I think I would still try to sell in the second session. And Kelly and I have both done that. Kelly, you've done that. Where you wait and you charge them, right? Like you put the birdie in their ear, but it's not money in hand that day. And that's okay. Because you know what? Every situation is not going to be cookie cutter. And we need to focus on the one thing, and that's getting that eval booked. So Tuesday at 1, Friday at 9. Which one works for you?
You're good about that. Pre-booking.
Yeah. And then that really builds consistency and increases our revenue. So this was great. I know this is a long-winded one, but it's really important because that initial eval is going to be bread and butter. Questions, comments, concerns?
I have a question.
Yeah.
They get to a point where they're still like you're talking to them about the objections, you're playing into the emotion, and for some reason, like you're just not gonna sell them on an eval right then and there.
Yep. You're getting ahead of me now. I love this. Keep going.
What is a good next step, basically? You know?
So another downsell. So this is great. I'm gonna get into this kind of in the second encounter too, but big things with I kind of did first and second a little bit in tandem, but we'll delve into this because you're asking, which is wonderful. So let's start with the downsells. So they say, no, I don't want to book an eval. What would you say? And you could be anyone. Mike, do you want to go? I know you're new to the party, but
That's okay.
I would recommend sorry to jump in there.
no, Mary's going, Mike. You got to beat her to it.
I would suggest, like a video consult, something like that. Something that it's like you can be making dinner and we'll just chat.
Okay.
So
How much are you charging for that, Mary?
that would probably be pretty minimal at maybe 50.
Okay. How long? How long
Half
you gonna
hour?
chat with them?
Like half hour.
Okay. I think that's low, personally. I think if we're charging 150 an hour, I think it needs to be like 75. But we'll say like 20 minutes. Maren, I want to
you
make
could
you.
say just 20 minutes.
Yeah. I think like 20 minutes. Good. $50. Cool. Okay. That's great. I think another thing is they're in pain. So we need to get them out of pain. How can we do that? Kelly, you're going to dry needle them because you're going to charge less for dry needling and you're going to do a VIP rate for this individual of $75 instead of, $119. And you're going to dry needle them for a half hour and they're going to leave and they're going to
No, I'm not, but I will do 99.
You would? Okay. So you wouldn't do 75
Ish.
for even a half hour? Because don't you do 45 minutes right now?
Yeah, I might. You could twist
Okay.
my arm.
I think the biggest thing is the price point, right? So we need to get
Yes.
this price point down to get
But if
them
you
in.
know that's like the big barrier, like
Yeah.
it's going to be a home run, and
Yep.
that that's the biggest barrier is that cost, then I
Yep.
do think that does make sense because Brandon does some things like, I mean, he goes really overboard with it, and his eval is actually free,
Which
which is interesting. Yes, because then he's going to sell these packages. His packages are a higher rate. They're probably 20%
So-
more than mine.
yeah. So Brandon charges $2,600 for his packages, but he does a free eval.
What's
So
his
that barrier to entry is super low. Go ahead, Mike.
what's his capture rate on that? Meaning he does 10 evals. Does he capture 9 of them?
Yes.
Or does he capture 2 of them?
No, if he gets them in for an eval, they pretty much close. One of the things that he did say, I'll be quick, Shana, and then you got other
Okay.
stuff too, is that to lower that barrier of entry to kind of do a downsell is he created half-hour visit packages, because he was like, because he does charge such a higher rate, it is a different individual, right? And he's like, so if someone's wanting to kind of like ease into, what he says is a luxury service, then he actually created a separate package for that, which I thought was interesting.
I agree. So I think what we need to not do though is downsell to the point that we're discrediting our services. So Kelly, I am so glad that you rebutted me because I feel like you're someone who will give a discount and be like, sure,
Oh, so fast. I'm
You're
trying.
so good.
You've been working. You've been really getting me. You've been working
Yeah.
on me.
So I think that Kelly's point that she said is exactly how we need to be. If they're like, well, can you discount the eval? No, but I could offer you a dry needling session for, $99 for 45 minutes, which is almost half the evaluation. And I think the big piece there is they're going to be happy about that because they're not having to pay as much, right? So I think overall, the downselling is for those who need the downselling, not for the ones that are already bought in, right? Because we don't want to sell this type of dry needling one time and then we're chasing them down and then we're not getting them in for an eval because then we're driving our revenue down, which we do not want. Okay. So now we're going to get into a little bit more of upselling and downselling from a discharge standpoint. So these are kind of follow-ups. So let's go into follow-up. Just one more quick example about this. So I think a good tie-in point now is they didn't buy the evaluation, they booked for the evaluation. They didn't buy a package, right? So now we're in that second encounter. We still need to sell them on a package. So Alex Hermosi gave this amazing example. He went into a suit store. He paid he didn't pay. He tried on the suit for $16,000. Okay. He's like, yo, I can't afford this. The owner of the suit shop said, hey, I got this other suit and I think it would look good on you. And it's $2,200 for a really, it's full tailor suit. It's a premium service. So I want to ask you guys, when you see 16,000 versus 22, what do you feel like this is a lot now that I told you you have another suit for 16?
Mm-mm.
Mike, would you buy a $2,000 suit after seeing one for 16,000? Two, you're like, I'm getting a deal, right? So I'm not buying suits, but I thought, Mike's a good example because suits are a men's thing. But I think it's a really good point, and I'm not here to talk about suits.
So
I
what
am
would you
here-
do in pricing for that?
Exactly. So we're going to get into that next. So suits, packages, same deal. Okay. So 8 visits. You're going to need 8 visits, which is $10.99. Okay. 8 visits. And this person's particularly only going to need 4. But this is how you would downsell them. So, you came into me at a really good time. We're going to use that shoulder injury as an example. Because you know what? I think we're way ahead of the 8 ball in terms of this recovery plan. Normally, someone with subacromial pain syndrome that's more chronic, I would treat them for 8 visits. But since you came in early, I think I'm only going to need to treat you for 4. And you know what?
Yesterday, I just charged the visit this morning because I was like,
Yes.
this really is typically
Yes.
8, but like it's early. You've had this before. I know you're compliant. Like we're going to do 4.
So with this, they're saving $549. So I show you 1,000. You're like, whoa, I just bought an eval for 175. Like, eek. But now I'm telling you that it's only going to be half. So you're downselling them, but I'm like frozen. Okay, cool. So that is how you could present it in one way. Erica, do you have any questions? Because I know you're really good at rebuttaling this.
I guess not really.
Okay.
Yeah, I think that makes sense. I could see some people still like maybe that not being something you could apply to everyone, like
No.
with every diagnosis or every situation. Yeah.
So what specifically would be a patient population or an individual that we wouldn't apply that to?
I guess I would say someone who maybe like is a little bit more inconsistent or might not be very compliant or
Mhm.
have something that maybe diagnostically like would be pretty easy to treat, but they have other life factors going on and that they might need more.
Mhm.
Even diagnosis could technically be done in 4.
Mm-hmm.
I could see maybe someone having some rebuttals for that or just as a practitioner being a little bit unsure about guaranteeing that.
Mm-hmm. So I think we always want to, over deliver and under promise. So I think that if we say 4, this is typically what I see. It's not 100% guarantee, but also we could do the converse. If we thought they needed 8, but they're really not bought in from a monetary standpoint, you know what? Let's start with 4 and we can see how you're doing after those 4. And you know what? Just for you, if we get to that point and you need a few more, we'll do another package of 4 and I'll honor that discount for you. Does that sound good to you? And then they're going to be like, yeah. So I think that's another way to approach it. I think this is applicable to all, but I think the recipe and the specificity of it needs to be tailored to make it not so cookie cutter, right? But I think the presentation piece needs to be so much more. I'm good, So I think that's really important. Does that make sense?
Yeah.
Any other questions?
With your
Okay.
chronic pain, would you how do you feel about packages with your chronic pain patients here? Because they've been around the block, right? So just interested in like, would you be like, no, don't do this with the psychology of it? Would you recommend not doing this for chronic pain patients?
I think because with chronic pain patients, getting the buy-in is so important with not just because their previous medical experience, but also because you need to have them bought in, like also from a mental standpoint to have that belief that this is going to work. So I would usually like break it up into kind of like the stages of their rehab and focus more on trying to just sell them for like that first stage, not even talking about, you know, the second, third, fourth, you know, stage or the longer term, but just that first, like, okay, what's going to be the first goal of the first like 2, 3 visits? And let's just focus on meet that goal. And to do that, this is, you know, this is like the package. So it's kind of a package, but you're just looking at it in more of like a like section, you know. And then yeah, I would approach it like Shania said, when you get to the end of that first step, then it's like, okay, then we'll talk about phase 2, and we've got, you know, packages, and I can honor that discount and whatever at that point, but let's not even think about that. Let's just talk about this first phase.
I
So
love that.
yeah.
So what if I'm like, I don't know if I even am going to need phase 2? Like, how do you even know I'm going to need phase 2?
Yeah, I mean, that's why I would just say like focusing on that first phase, like not
Yeah.
even like not being really light on the education, like not talking about, you know, how we're going to do this long-term thing that's going to be weeks down the road or whatever. Like just
I love
talking
that.
step is just to get you, you know, feeling better.
I love it. And I think the biggest thing is sometimes we're apprehensive, but like we need to get them when we have them. So if you don't get them on that free consult call, not a good thing, right? Like if you're in that consult call, you need to book that eval that day. And you need to ask as many questions as you need to ask. And even if it's longer than 15 minutes, keep on asking, because you will get there. And I'm not going to say this is guaranteed for every single individual, but I think that's kind of where we're headed to as a company, is like reviewing these consult calls and delving into them so that we can pick them apart. And how can we ask that a little bit better? I mean, Kelly and I improve every single day with our delivery in terms of this. And I think as clinicians, I bet we can all attest to this. Like we go into eval, ooh, you know, I could have did something a little bit better to either, you know, speed up my time, or maybe I didn't need to test that nerve because they didn't really say they have nerve, you know, like we go in our heads, and the same rules apply for the upselling and downselling and just getting them in the door. So the goal is to truly get the emotion, but always have that thing in our back pocket, like, oh, they don't want the eval, let's get them in for a manual therapy session or dry needling. Mike, that's great for you too, right?
Yes.
Getting them in for manual therapy would be great, because
Mhm.
it's a good downsell, and then you can buy them in.
Yeah.
And
So the question I would have to something you said previously, where you said, I'm going to make sure you're out of pain on the first visit.
in less pain than when you walked in.
Sorry about that. Yeah.
Nope.
But we can, let's say it's a frozen shoulder. I know I'm going to hurt them that day.
Yep.
It's just going to be. Now I could not, right, and sacrifice range of motion gain, take off 20% of, you know, of the progress to make sure I didn't push them over where they have 3 days of soreness because they don't know me, and man, this hurt like heck. I'm not going back to that.
So I think with that, like you can push them, but then I would cup and I would dry needle after, so they feel that those muscles are less restricted when they walked in. And those are two different pain points. We're getting them more range. Yep. So truly, like they're feeling quote unquote better, even though we're pushing them. Like that pain and persistence of when we push them, they might be a little sore, but they're not going to feel that same pain when they leave. So I think with frozen shoulder, I'll always follow up with manual after that, so that they feel like those muscles around the shoulder joint are less restricted, so they feel less discomfort than when they walked in, right? They're going to have better range. Yes, you're going to make them have a little pain, right? Or discomfort. And that's not the goal. Like I'm trying to improve your range, but you know what? We're going to push through a little bit of the discomfort first, and then I'm going to dry needle you or cup you after, so that those muscles feel like they're not just all tight and taut. Does that sound good to you? They're going to be like, yep. And I feel like the outcomes are so much better when you do the nuggets that you need to do. And then you kind of put a Band-Aid, not a Band-Aid, but you kind of just like, you're okay, you know, afterwards. So it's like, yeah, we're going to push a little, but I'm also going to allow you to have some relief today. Okay. So it's never curing the pain. We never want to, you know, over promise and under deliver.
No, I get what you're saying. Yeah, I misspoke on that.
No, you're good.
I get what you're saying.
No, but that is an example of an injury that's probably going to take 8 or more visits, and it's probably not going to be one we're going to cure in a few. And that's okay. And I had someone who's been on my caseload almost a year. I just discharged her a couple weeks ago. And like, she's doing awesome, but it was a roller coaster of PT. And it's not going to be, I'm going to sell her an 8-pack and woohoo, we're done, you know? And that's frozen shoulder. So that's a great example, Mike. Thank you so much for bringing that up.
Oh, no problem.
Okay, discharge. So they're done, right? What are we doing? So when you discharge someone, what do you say to them before they leave? Are you just like, Hi, I'll see you next time. Anyone want to talk to that?
I mean, always talking about like what the next step is, because it's not the end really. There is a next step. It looks differently. So just making that is.
A+, not the end. It is not the end. Patients, we can always do more for them, and we know this. And this is why we're not in the clinic, because that would be doing them a disservice. And if they fall off the bandwagon, those 4 visits were a complete waste of time, right? So we want to ensure, number 1, when are we following up with them again? Okay? You always need to tell them that. Number 2, and again, you can practice how you want, but I think you should always follow up with them, because then they feel like, sometimes they're scared. They're like, we're done? And you're like, don't worry, I'm going to follow up with you when? I always use 2 weeks as a good timeline. Maybe a week if it's someone who's a little bit more needs the hand holding. That might be your chronic pain patient, Erica. They might want to be heard in a week, which is fine. But I think we need to have a game plan for after. So, okay. And then
when you're saying follow up, you're following up with a phone call or following up with a visit?
Following up with a email, a text, or a phone call. Yep. Usually text is what I do, which I don't know. That's sometimes I give out my phone number still. Kelly, do you?
Kelly?
Yeah. Okay. I figured. Okay. So I usually just text them 2 weeks, see how they're doing. If it's someone who's more formal, you can email, but it's not a formal visit, right?
You can also text through Google Voice too. So like the Google Voice is on my website, and that's what people will ask me, like, oh, is this the number? And sometimes I'm texting from the other number.
That's a great example. Okay, so I think the big thing is, when are you following up with them? What's next? So I want you to continue your program, right? And I want you to stay consistent with it, even when you're not having pain. Because now we've gotten there, and that's when we see the fall off. But how do we upsell them now? Because we're like, ooh, I don't know, right? What do I do now? Well,
monthly membership.
Hey, Kelly. So Kelly has monthly membership, HEP revamp, dry needling, cupping. Boom. She just upsold. A+. Okay. I also would say, hey, I know when we last tried needle you from your previous session, it was about 3 weeks that you felt solid. And then by week 4, you were kind of like those muscles were flaring up again. So you know what? I think we're good from a range of motion and strength standpoint, but I think you'd really benefit before that tournament to come in for dry needling in 3 weeks, since we're really close to that big game day. Does that sound good to you? And they're like, yep. So you could also sell them on another in-person service. Any other ideas of a standalone versus the membership? The membership is awesome.
And what does the membership look like?
So that's the HEP, dry needling, and cupping. And that's, is it $149.99, Kelly?
Yeah, right now it's at $149. And so they can have one of each of those things. I may change that, but I only offer it to people who've done a complete program and been discharged. So that way it's not just people like getting Band-Aids,
And they come how often? How often could they come for that? Is that
they could come 2 times in a month for 30 minutes. Yeah.
Okay.
So I would either do, or 20, like I would either do a quick cupping session or I would do the dry needling session. But they can have one of each or 2 of each, depending on what, like even though dry needling it costs more, that they could choose the 2 dry needling or 2 cupping or one of each.
Mm-hmm.
Okay. And then I think that's so good. And I think the membership like makes them feel like, yay, like I'm buying into something that I'm a part of now. Like it's a community tie. So I think that's a really good thing. And I feel like we could all improve on that too. But I think the other thing is like a maintenance manual therapy session. So just like I said, you could also offer cupping manual therapy in general so that their pain stays at bay while they continue to do their program. Because we know from research that hands-on is really what elicits buy-in, and they're going to feel better when they leave. So that was a great example with the frozen shoulder, is they might want to come back just for manual. So example for me, I followed up with my patient post-op, or excuse me, not my post-op, but 2 weeks post-discharge of the frozen shoulder, and she's still having bicep tightness. So she wants to come in and get cupped kind of for her delts in her bicep area, but her range is solid. So that's a great upselling point when you follow up. So if you don't sell them at that visit, you can try again when you follow up them in 2 weeks. Does that make sense? Because sometimes it's easier when they're not feeling good to upsell
that. Then talk about, okay, now that you're feeling better and you're out of pain, you've got range of motion, your function is back. What are your next goals? Like, do you have
that?
Or are we training for something? Like, you want to the gym with you, you know, talking to them more in the before discharge, even getting to know what's their next goals.
And that's where the downselling can come in. So for the CSCS, CPTs out there, in general, if you have interest in exercise, this is a great downselling point. So I'll follow up with you in 2 weeks and see how you're doing. But if you want some extra homework, I have these mobility programs that I offer for $99, normally a $340 value. But for you, I'm going to offer them for $99. You can do these at your leisure. So kind of in between those days that you're doing your home program, they're like, ooh, and then you could even show them to them. So I think that's a great idea for a downsell. And then, so why would you want me to do those? What would you guys say?
To maintain the gains that you gain during PT. It's like a more cost-effective, cheaper way to maintain what you paid for in PT.
I think cost-effective is better. I think like cheaper. We don't want to say cheap because we're not cheap. We're valuable providers here. No, I'm still getting better at that, Erica. But I try not to say cheap just because I feel like then it's like, well, then our services are expensive, but they're not, right? We don't want to say something is expensive because it's all relative. So I think big things would be increased range of motion, decreased joint stiffness, and then a great warm up for when you hit the gym. So that if they're like, you know, I got a bodybuilding competition coming up, I don't know, this is just a specific example. Then they have some tools. And you could go crazy with this. And we can talk with, you know, you guys specifically on what that looks like. But I think the biggest thing is we need an end with an upsell and we need an end with a downsell. So I absolutely love that idea, Erica, before you even downsell them, like, so what other goals do you have? And they're like, oh, I want to complete a marathon next year. And you're like, great. You know what? If we can really keep these strength gains going and get you working on those mobility programs, I think it'd be a great start. And these are way more cost effective than if I'm seeing you in person. You can do them anytime. And they're like, yep, I'm in. Does that make sense? Yes?
Yeah.
Cool. Okay. I appreciate you guys with all the insight and kind of benefits, negatives. How do we get out of the hole if they're not bought in, right? But I want to open up for questions and just see what specific questions you guys have with regard to kind of this upselling and downselling model. And maybe where do you worry or kind of have a little apprehension about applying it in real practice?
I have a question if you have any insight on timeline, because the upselling that we were just talking about at the end, let's follow up in 2 weeks and someone like they don't necessarily have anything on the horizon, next goals or anything, and they're still feeling good and they don't feel like they need anything at that point. Would you recommend another like maybe 30 days from there, like reaching out again and checking in again? Like how do you check in with those discharge that maybe didn't buy anything right away?
Yeah, I think it's a good, like, that's where like you come in with your like emailing nurturing series, right? So I apply this not as an emailing nurture series, but as like a patient follow-up revenue standpoint. So you follow up with them in 2, they're not sold in the mobility programs. Is that what we're saying? Like, they're like, I'm still good. I don't think I need it, right? I think following up with them in another 2 would be great. Kind of that 30 days out and just be like, yeah, now that we're 4 weeks out, I remember last time, you know, you were kind of feeling like that muscle tension was creeping up about that 4-week mark. Like, how are your workouts going? How's your home program going? So I think that's a great way too, Erica. If they're like at that 2-week mark, they're not quite ready, you could push it out to 4. And then I also think that at that point, you need to ask questions about like, why specifically do you feel like these programs wouldn't help you? And they're going to have no clue because they know they will, but they're just not bought in. So I think like you can always sell even if they're not sold in that 2-week follow-up. But I think delivery is huge. So I think a text is awesome for the initial, but I think you need to follow up with voice memo because it's a lot more personable. They're going to feel heard, and then you can really feel their tone. Does that make sense?
Yep. Yeah, I think the email nurturing series would be awesome too to put this in, because we can even put in, you know, like videos or whatever and be like, hey, it's, you know, like, how's it going? And just like little personable things like that, I think would keep like they're still important to you, even though they're discharged, you know, and you're still going to be their go-to when they are ready, you know, they do have something else they need or whatever.
I agree. Thank you. That was a really good point too, because sometimes it's hard. It's like, well, what if? I think we wait on the what ifs until we get there just because we'll drive ourselves nuts. But I think like you need to have that plan B, right? Which I love. So following up with them in another 2 if they don't buy is great.
Yeah. Well, and you can see the ones that are not scheduled. Yeah. So on Jane. So this was so good. Thank you so much, Shania. I'm glad you could hop on mic. So hopefully this is helpful for everybody to upsell and downsell. I apologize for the technical difficulties, but I'm going to stop the recording.